Hi, everybody. My name is Cindy Miller. I'm a registered nurse, and I work in the Scientific Affairs Department at Solventum. And today it's my great honor to introduce to you Dr. Michael Desvigne, and we are going to have a conversation about his poster. Before we get started, Dr. Desvigne, will you tell the audience a little bit about who you are and what you do?
Absolutely. My name is Michael Desvigne. I'm a plastic and reconstructive surgeon. I practice in the Phoenix, Arizona area, and my focus is on wound reconstruction, both from a surgical and non-surgical point of view.
Tell me a little bit about why you did this poster. Let me tell the audience first what the name of the poster is, so if they want to go look it up online. This poster is called The Evolution of Negative Pressure Wound Therapy Using an All-in-One Encapsulated Open Cell Novel Foam Dressing.
So I wanted to be able to share my experience with the new dressing. I was lucky enough in my team, we were able to trial out this dressing when it first became available.
Well, let's move on to case number 3. Now, this one looks a little... That's a tiny wound.
It's a tiny wound. You're exactly right, Cindy. So this particular one, this is a 54-year-old patient who had the spinal surgery and ended with a non-healing wound. So this wound was a distal portion of the incision on the lower back. So she was lying on this. Again, this is a sensate patient. The concern, as you mentioned, it's a tiny wound on the outside, but it went a good 4 or 5 centimeters depth. So once again, tiny wound, but we still chose the larger dressing, again, because this is the one that will allow us to get to that up to a 6 centimeter depth. This one wasn't quite maximum, but it was close. And so we chose the larger dressing so that when we get the drawdown, again, the tissue is being drawn up to the wound surface. You can actually see that on the B slide, where you see that little indentation where the tissue is being brought up to the actual dressing itself.
So you chose the large. Even though the wound was small, you needed the large so it would have enough movement capacity to go down.
That is correct. And I will share with you the other reason that my preference is to go with a larger size dressing is, again, the soft tissue recruitment of the local area. So if I'm especially now that I've learned I can actually achieve closure with this dressing, I want to recruit as much tissue as I can. And so in my opinion, I would probably always err on the side of a larger dressing, meaning that I want to recruit as much of that tissue as I can to kind of get that micro strain and macro strain to give myself more availability of tissue to help to close the wound. So this was a fabulous case because this case was actually able to achieve complete healing without surgical intervention. So this patient, again, non-healing surgical wound with hardware in place, previous spine surgery. Now, we couldn't see the hardware, which was good.
But you knew it was
we
there.
already knew that the hardware did not appear to be infected by the orthopedic or the spine surgeon's report. But once we started the peel and place dressing, we continued her for weekly visits. The external wound, of course, was already small, but the depth was starting to reduce. And that's where we knew we were making progress. And then at the end of just a few weeks of therapy, we were able to stop. There was no depth to the wound bed. We simply continued with a collagen dressing. And then the next week, she was healed completely, and she did not require any surgical intervention. And in fact, I had her scheduled for surgery just in case, and we were able to cancel her surgery.
Wow. Now tell me about the appearance of the peri-wound skin. It looks a little red.
So on this one, and actually on her first one, she had previous negative pressure therapy that actually was held because of all of the peri-wound irritation. So she clearly has some very, very sensitive skin. So when we were able to start the peel and place negative pressure wound therapy, it was better. And then it was actually pretty good for the first couple of weeks. And then especially, it's interesting, as the wound got smaller, because it really wasn't a lot of wound at that point, but there was probably a little bit of irritation. And so at that last week, we decided just to hold it, even though the wound at that point had already done 95% of the closure. We thought it was safe just to continue with the oxidized regenerated cellulose, collagen, just to get to that final reepithelialization.
And it's such a balancing act, isn't it? You're weighing the pros and the cons, the risks and the benefit of peri-wound irritation versus the healing. And
absolutely, and always, and I very rarely have seen any irritation with the hybrid drape. But again, if you see it, you just try to address it.
Well, thank you so much for sharing your experiences with us. We
my
really
pleasure,
appreciate
Cindy.
it, as always. And audience, if you have any questions, please reach out to your local Solventum rep. And this poster will be available online at the SAWC website. Thank you so much for joining us.